Okay, you're up, Tom.
Okay, well, welcome and good to have everybody here. I've got a bunch of texts that Comcast was going to be working right today, and that we have our service might go out. So if I disappear, that's what happened. Then I got one that said it's postponed until 11:10, and I'm thinking, wait a minute, that should have come yesterday. But anyway, I'm Tom McIntyre. I'm the chair of the coalition. Been on since day one, since we started, and I'm retired. I've disassociated from almost everything except the coalition, so hanging on to that for sure. So Joe, I can't see everybody, so would you call people out to introduce themselves?
Absolutely. So if you can, will you go to your button on screen and raise your hand? So wait, now that button's not on my screen, so oh, I see hands raising. Everybody else can see theirs. It's under reactions. So there's a smiley face with a plus sign. If you click that, the bottom tab is raise your hand. And while you're raising your hand, I will call on each person here to introduce themselves. Chris Jury, good to see you.
And I'm introducing myself, correct?
That's right.
Okay. Yes. Yeah, Chris Jury. I'm the prevention manager for the Northwest Education Service District. Worked in Monroe for many, many years in a number of different contexts, but now I'm managing your student assistance professional as part of my team, and happy to be able to check in.
Thank you. Rachel Adams.
Hi, I'm Rachel Adams. I am the Human Services Coordinator for the City of Monroe and staff support for our Community Human Services Advisory Board. Yeah, I have been working on grants, as I said before. We've got a lot of amazing programs starting up. Of interest to this group, especially, I think, is our mobile mental health that we're working with VOA and the City of Sultan to begin. And we're in the process of, we have implementation funding for that, and we're in the process of hiring for the mobile mental health clinician position, which is hard to say. But Joe, if you know of anybody, I would love, it would be a good fit for that position. It's going to take a special person because they are going to get to go out and meet people where they're at. So I would love to connect them with Brandon from VOA and get that program started.
Yeah, I'll put out some feelers too.
That would be wonderful.
And the challenge right now with staffing any position is everybody's moved into private practice.
Yeah.
So, but yep, I'll put it out.
No, that's one of the challenges. I mean, I'm finding out all sorts of different challenges with capacity and the amount of training that has to go into it, and then insurance reimbursements. But that is, moving into private practice was not on my list yet.
Yep. Thank you, Rachel. Aubrey, would you introduce yourself?
Hi, I'm Aubrey Rudd. I am the communications director for the Church of Jesus Christ of Latter-day Saints Snohomish Stake, and I sit on the Just Serve Council, which is a nonprofit that tries to match volunteer opportunities with people who want to volunteer in the community. So keep me in mind if you guys have volunteer opportunities or other ways that we can connect people who want to serve in the community with people who have things that need done in the community. So, yep, keep me in mind. And a parent of kids in this school district.
Thank you.
I would love to get your email address. I have a list of our nonprofit service providers that are looking for volunteers right now. So
perfect. I'll drop it in the chat.
Thank you.
And this is the Coalition in Action. Julie, welcome. Would you introduce yourself? Oh, you're on mute.
Yep. There we go. Hello, I'm Julie Lund with the Compassionate Friends out of Snohomish County. And what we provide is bereavement support after the loss of life to a child. New to Snohomish County, providing bereavement support to the bereaved parents, the siblings over the age of 18, because we are a peer-led support group. We also offer support to the bereaved parents, and the loss of life to this child could be from the unborn, so stillborn, miscarriage, infant loss, epilepsy, cancer, adults. We support the parents of that lost a child at 64 years old to cancer. We are a not-for-profit organization. We have over 500 chapters. The next closest one is in Kirkland, but we're new to Snohomish County. We've been active for 2.5 years and just trying to get out the word out, and just reached out to the recent shooting at Ingram High School and made resources available, because that's what I do. I have resources available for not only the counselors, but also the parents of this child that lost his life to the shooting. And to those students, I have resources available. And I'm just trying to get the word out that we're here, because I know that someone's isolating and doesn't know that these resources are available, that I'm available. And yeah, so that's it. That's all I have to say. So happy to be here, because I'm after all the resources that failed and there's been loss of life to the misuse of drugs.
Thank you.
So I'm here to support that parent and siblings and those that support them, the resources available.
Thank you. Maddie Louder, before you speak, I'm going to embarrass you just by saying to the coalition, man, Chris Jury did us a solid when he brought Maddie to Monroe. I have not met a person with so much energy around prevention in years. And so Chris Jury, thank you for the gift of Maddie Louder. Okay, Maddie, now you're embarrassed. Would you introduce yourself?
Well, thank you for that, Joe. My name is Maddie Louder. I am the student assistance professional at Monroe High School. I focus on substance use intervention and prevention. It's keeping me real busy this year, lots of stuff going on, but I'm loving my job, love every minute of it, and I love supporting this community.
Thank you. Pastor Michael Hanford.
Hi, everybody. It's my privilege to serve with Joe on the coalition leadership team, and Tom and Mary, who's in Mexico. And also I'm a chaplain. This is my 26th year as a chaplain for Monroe Police and Fire. This coming week is Police and Fire Appreciation Week, and I hope everybody has posters and has written little notes of thanks to police and fire. And we're excited. The banner will be over Main Street this year. We have the banner up for the veterans this week, and then next week is Police and Fire, thanking the vets this week and thanking Police and Fire next week. I also serve as a coordinator for the Monroe Pastors Fellowship and the Congregations of Monroe. So it's good to be all with you all who are doing so many incredible things. Thank you, everybody, for all you do. I love this time. God bless.
School Board Director Chuck Whitfield, good to see you. Would you mind introducing yourself, Chuck?
Sure. Chuck Whitfield, Monroe School Board Director. And just as a note, when I wrote down November 10th, that's our 38th wedding anniversary. So my wife has tolerated me all those years, which is a good thing, and supports me with the school board. I wanted to touch on a Rotary meeting that we had yesterday. Chief Jolly and I both attended. We had the district governor for our area, and it's called District 50-50 because half of it's in Canada and half of it's in Washington, kind of Everett North. And the district governor talked about three main items that relates to the coalition. The first is the mental mental distress that individuals are facing up in the White Rock area that he's part of. He's talking about domestic violence and the troubles people are having when they lose their home, and they bought a nice house and now they can't afford to live there. So he mentioned that. He talked about bringing inclusion into the Rotary International. It's an international organization, by the way. Must be like 30,000 clubs internationally. About having members of Rotary, even such as our small club, having individuals with disabilities. We haven't had one, or haven't had the opportunity. They're going to have a keynote speaker at the conference, is going to be a fellow that's blind. And so he's going to speak to that. And one other thing that is interesting during these times, you know, with the conflict in Ukraine and throughout the world, is that Rotary is an advocate of peace. And, you know, Chief Jelly and I are both veterans, and we have I have my view on war and conflict, and it just seems to be, you know, unending over time. But an organization promoting peace internationally has really struck me. And, you know, I don't know how that happens, or how that can be implemented, but it's a noble cause, and it's something that we should hope for. You know, the peace in Ukraine and Russia, you know, good grief, it's just going to escalate. It's just going to get worse, and then supply chain, and we need peace. So those three things really stood out to me, and an important visit from a district governor of, I don't know, maybe 100 clubs. So
Thank you, Chuck.
that's it.
Chief Jolly, welcome.
Thank you, Joe. Always good to be here with everybody. And Pastor Hanford, I'll make sure that I appreciate the police next week. So I appreciate those words of support, and I appreciate
Amen.
I appreciate this partnership, Joe, and you know, our department, you know how I feel. We're part of the community, and we're ready to partner with anybody and try to make this a better place. Just piggybacking on what my name's Jeff Jolly, if I didn't say. I'm with the police department. Just piggybacking on what Chuck had to say, we met the District Governor Raj yesterday, and what an amazing man who was born and raised in India, been involved in Rotary for only 8 years, and has taken on this role to really make his place and his space an open and accepting area. Just inspired me to the point where I've already signed up for the district conference next year. But the theme of it is what I think we kind of embody here in Monroe, and it's imagine a peaceful and inclusive world. And really, that's really what it's all about, right? And that says it short and to the point. And so thanks, Chuck, for bringing that up, and just a great message. So I'm happy to be here. Thanks.
Thank you. Amber, you're next on my screen. Welcome. Oh, looks like Amber's busy. Sharon, welcome back. For those who don't know, Sharon is a national trainer in one of the coalition's programs, Sources of Strength, which she's rolling out at Park Place Middle School on top of everything else she's doing. So Sharon, I love that you could be here today.
Thank you, Joe. My name is Sharon Lineweber. I'm a middle school counselor here at Park Place Middle School. And yes, we are rolling out Sources of Strength on top of everything else. So I'm glad to be here.
Would you mention what Sources of Strength is?
Sure. Sources of Strength is a peer-led initiative program that focuses on the strengths that students have in their lives and ones that they can increase to help them increase their access to services, their their positivity, their inclusivity, all of the ivities that the idea is that it's peer-led. We train the peers. They have these initiatives that they roll out a few times a year just to support students, to recognize their own strengths, and also break silence and around needing help and connecting students to help when they do need it, and changing school culture. So that's our goal. Nothing major.
Nothing major. I'm glad I asked you. You said that so well, though. Thank you.
Thank you.
And oh, every time I look at your picture, I'm so excited. Tammy, welcome. Would you introduce yourself?
I'm Tammy. Hi. I'm a counselor at Park Place, also with Sharon. I've been out to lunch for a couple of years, but I'm back now, and it's so good to see you. Happy faces. I love this group.
Now you're up, Amber.
Hi, I am also at Park Place. I am the student support advocate.
And Sheridan, welcome back.
Thank you. Hello, I'm Sheridan. I'm the child and family specialist for Housing Hope. So I work with children and families in the school systems for our parents that live on Housing Hope properties.
And Sheridan, you're getting around. I saw you at Frank Wagner the other week. You have hit the ground running. Kathy Jackson.
Hello, I'm Kathy Jackson. I am the Family Engagement Liaison for the district, and I support Frylands, Maltby Elementaries, and Park Place and Hidden River Middle Schools. And I just wanted to thank Chief Jolly and Chuck Whitfield and any other veterans on our screen just for your service. And I was telling Joe earlier, at Maltby, and I think all elementaries and middle schools, they had Veterans Day celebrations, and it was just so exciting and just heartwarming to see the patriotism that is growing in our children, and just the just honoring of service people that have served in our country. So, and just to have an assembly. This is the first time in like 2.5 years that we've had all assembly with the public welcome on our campuses, and so it feels so good. So thank you.
Awesome. And then I have saved our special guest, although she's a familiar face for us, Juliet D'Alessandro.
Thanks, Joe. Hi, everyone. I'm Juliet. I am a healthy community specialist at the Snohomish Health District, soon to be Snohomish County Health Department. And I primarily work on opioid prevention related projects, but I'm part of our Healthy Communities team there, which represents all of our substance use prevention work and our injury prevention work, suicide prevention, etc.
Awesome.
I'm happy to be here.
I'm going to hand this to you in just a minute. I'm going to share my screen really quick. So the agenda for today is pretty brief. We're through welcome and introductions. We're going to hand this off to Juliet to dazzle us with her expertise and all of the work that she's been doing around the region to help prevent opioid use and overdose deaths. And then I'll do some quick business updates, very brief. And then if we have anything left to discuss, I want to hand it off to you guys. Last month, I heard loud and clear that we do have some interest in learning about how different immigration issues may be impacting families in the community. And I want to put together a good presentation for that and line up some good guests. Haven't had time to do that. And Juliet knocked our socks off at our last regional opioid consortium meeting. So I just took advantage of what she's doing and invited her here to share with you. So Juliet is up. Opioids in Snohomish County. I'm going to stop sharing my screen. And Juliet, do you need to share yours? Let me.
It looks like I can.
Oh,
good.
good.
Nope, never mind. It's disabled. I do need permission.
Okay, let me find participants, Juliet, and make co-host. There you go.
Thank you. There we go. Okay, perfect. I am going to start with slides, and then I will one piece I'm going to switch to just sharing my screen on Chrome, which hopefully I will navigate through. Okay, but I don't make any promises. Okay, but to start with, I'm hoping everyone can see some slides.
We can see,
Great.
we see your whole, the PowerPoint behind the scenes.
Okay, let's
Perfect.
see if I can remember how to present. Is that the present button?
There we go.
Okay, perfect. 3 years of using Zoom, and you think I would be a little better at this yet, but I'm not. So thank you for bearing with me. So as I mentioned, I'm Juliet. I work for the health district. And I currently, in my role, coordinate a rural focused opioid overdose prevention and response project. And with that project, we have a consortium of fantastic partners, of which Joe is one of our very fantastic partners. So for today, I'm just going to give a bit of an overview of kind of the work that my team at the health district does generally around opioids. My part is geographically actually pretty small compared to what my two colleagues do. And then I have a couple other pieces. I just kind of want to show that I think are relevant in terms of what's available and for a county-wide that you all can access, and then some emerging trends and just stuff to know. And feel free to pop in, and if you have questions, maybe Joe, if you see like a hand up or a chat, would you let me know? I'm not great at double monitoring that while I'm talking. So I don't want to miss anything, but feel free to interject if you have questions along the way. Okay, there's a lot of text on this slide, so apologies in advance. I can send these out after, so don't worry about trying to read it all. I just was capturing what our team does. So I work with two other people who on opioids specifically. So my colleagues Abby and Brenna actually do most of our countywide focused work, and I do kind of this more narrow geographic scope work. But overall, this is kind of what our team does. So we offer Narcan trainings for community organizations. So pretty much anyone in the community can request a training on Narcan, and Abby and Brenna are able to coordinate that for them. I will send this out so you have the links that are embedded in here if you want to access it, but there's just a link through our countywide opioid website that you can request a training for your school district, your community. Joe, I don't know if they have done one before, or if you've had Amy do one for the coalition. I couldn't remember, but
you know, we haven't, but it would be awesome if we held a Narcan training. Like, that's a great idea.
Super. I didn't put too much actual Narcan hands-on info in here because I figured they are more of the experts on that than I am, but they are great at that. And I know Amy Wheat with Snohomish County also offers those. So between
Julia,
the
will you
three of us,
mention what Narcan is?
Yes, I thank you. I have it later on, and I should start with that.
Okay.
So yes, no, I think mentioning that first is excellent. So Narcan is an opioid overdose reversal medication. The actual drug or medication's name is naloxone. Narcan is the brand name, and it's the brand name for the nasal spray version. I actually have like many of them sitting in my house waiting to get labeled, and I should have unboxed one to show you all. But Narcan is specifically the nasal spray version of naloxone. So what is mostly given out to community members, and if someone were to go to a pharmacy and try to get it, to get naloxone, generally someone would be getting the Narcan little nasal spray version. There's also like a intramuscular version that like EMS is more likely to use than the nasal spray. It's a little more precise. But for most folks in the community, unless you're like a medical professional, if you're giving someone naloxone, you are giving it in the Narcan nasal spray form. And I do have a little picture of what it looks like later on. But thank you, Joe, for pointing out that I should start with that. It's really straightforward and easy to use. So it does not require like a huge 3-hour training. we just offer a training that also has some background information on opioids and what an overdose looks like and why overdose happens, etc. But using the Narcan itself is really straightforward. You literally just like open the package and then put it in someone's nostril and pump a little sprayer, and then you call 911 and make sure that they start breathing again. So we offer those trainings for anyone in the community who wants to request them. We are sometimes also able to offer Narcan for folks who do those trainings, but not 100%, because although I wish we did, we do not have an endless budget for Narcan at this point. And then the piece that Joe mentioned and that I've mentioned that Joe is involved with is our HRSA R-Corp grant, which is a federal grant through the Rural Communities Opioid Response Program. We have an implementation grant through that funding source, and it specifically covers rural communities. There are grantees across the United States, and in Snohomish County, we are a mostly urban county, but we do have 2 rural census tracts, which is the census tract that surrounds kind of the Darrington area, and then the census tract that surrounds part of Sky Valley, but not all of Sky Valley, which makes our work a little wonky. The census tract does not actually include the city of Monroe or like the boundaries or most of the boundaries of Sultan or Gold Bar. It does include index, and then it includes, it's probably easier if I meant to put a picture in here and I didn't do that. So I'm just gonna show it real fast if I can successfully swap my screen share. So these are the 2 census tracts that are covered, or that what is considered our service area for this project. So the Darrington area is pretty clear cut because it's just in the middle of that big census tract. But for Sky Valley, so the blue is what is covered, and the rest of the outside of the blue is not. So obviously there are a lot of folks who live in these areas who, you know, send their kids to school in Monroe or Gold Bar or Sultan, Startup, etc. And, you know, maybe get services in those cities and towns. But this is where we are actually allowed to do work and provide our services. So it's a little, the boundaries of this are a little wonky. I asked our grantees or grantors nonstop for extra permission for, can we do this one thing just outside of these boundaries? But the grant itself is actually a really fantastic grant. It covers, okay, I'm gonna not try to talk and switch my screen share because that's risky. PowerPoint share, okay. It covers, there we go. It covers a lot of activities across the whole spectrum of youth prevention, overdose prevention, treatment, and recovery. So within that, as I mentioned, we have a consortium of rural providers who are all absolutely fantastic. We've got folks from every coalition that's within or around those communities. So Joe's there. Rachel from the Sultan Coalition is there. Mari from Darrington's Coalition is there, which is just fantastic to have those prevention voices in that group all the time. And then we've got some treatment providers, recovery folks, government folks as well. So within that project, we had a bit of a slow start mainly because of COVID, but we are working on piloting a Narcan leave behind program. So one of our other activities that we coordinate countywide is to provide a number of law enforcement agencies with Narcan for their officers and deputies to have on them. But this would be kind of an expansion of that, so that when someone is responding to an overdose related event, or if they think it's appropriate, they can actually just leave a kit or 2 of Narcan behind with that individual or their family member. We have funded Darrington School District to be able to add a middle and high school counselor for their school. We've supported local drug take back efforts. We have a community education and hopefully stigma reduction campaign that is running right now on Instagram and Facebook, and they've got a couple radio ads and some digital banner ads as well. So I think it is kind of like geo-located where folks get those ads, but it's possible you guys are probably more likely to have seen them than I am, based on the fact that I live in Everett. So that campaign directs to Snohomish Overdose Prevention, which is our countywide overdose prevention resource website. So I've been coordinating that for a few years now, and I really love that work. But some of the other work that my team does involves a data partnership with 2 of the bigger hospitals in Snohomish County, Providence at Everett and Swedish at Edmonds. And that partnership enables us to get some data from emergency departments around the circumstances around non-fatal overdose incidences. And through that, we're also able to kind of do some patient follow-up or support folks who have experienced a non-fatal overdose. But that data piece is really helpful to have, just to kind of, we have data on folks who die from overdose, but also knowing about folks who have overdoses who make it to the hospital and live is really useful and important for our prevention work as well. We just this past August held a conference for professionals in the field called Pregnancy and Beyond, basically for providers who work with pregnant and parenting individuals with substance use disorder. We did one pre-COVID, and then we've had a few attempts that got canceled due to COVID. So we were really excited to get to do that conference again. Basically just to increase avenues for support for those individuals in terms of, treatment, and then resources during pregnancy and postpartum as well. As I mentioned, we provide and then track the use of Narcan currently for 12 law enforcement agencies in Snohomish County. We provide free needle cleanup kits to residents and business owners in the county. So if it's more targeted for, like, if someone had a large site they were going to clean up, or if an organization were going to do a bigger cleanup and needed a way to safely collect and dispose of those needles, we have those available to anyone who needs them. They are also available at a few other locations throughout the county, so you don't have to come to the health district to get them, but you can come to the health district to get them. And then the disposal kits just have clear instructions on, like, where you can take them to then dispose of them. But that is free, so you don't have to pay to, like, drop that off at the collection center. I'm forgetting the name of it. Yeah. And we do have more information about those on our overdose prevention website as well. We support Narcan distribution to schools, all, at least high schools. Joe, you maybe can correct me if I'm wrong, but high schools are now required to have, I guess, at least one kit of Narcan and a trained person on site who can dispense it. But Narcan is not the cheapest to access, and the state did not provide those for free for schools. So there is a program in place with some of the the distributors where they, I think, will do like one kit for free, but that kit gets used. We're able to supplement and provide those to schools. And we are doing it for middle schools as well. So if a middle school would like to have Narcan on site, we are providing those. And then we have a few things we are optimistic and excited for coming next year. We are working on a Narcan distribution program through pharmacies in the county just to help Narcan be more accessible. Currently, any person should be able to go to a pharmacy and get Narcan if they would like to have Narcan. You can purchase it through your insurance. If you don't want to do it through insurance, you should be able to just purchase it over the counter without insurance. The cost varies a little bit based on your insurance provider. If you have Medicaid or Medicare, it also is covered. We know that occasionally, though, folks have had issues at certain pharmacies or have gotten some pushback or questions around, like, why would you need this? You know, you don't have an opioid prescription, or you don't look like someone who's going to overdose or something like that. So we're also doing some work on the back end around pharmacy education so that all pharmacies know that that anyone should be able to go into a pharmacy and get that, and they, not to create extra barriers in folks being able to access a really important, really life-saving medication. So our hope is to increase kind of just like free distribution of Narcan through pharmacies. King County currently has a program like that has been really successful for them. So we're hopeful we'll get that up and running next year. And then in addition to the rural pilot of the Leave Behind, the Narcan Leave Behind program that I'm working on coordinating. We actually got a new grant that just started in November that my colleague Brenna is working on, which should allow us to expand that to a state, or not a statewide, a countywide effort. So working with first responder agencies countywide who would also be interested in doing that Leave Behind piece. So basically, we're looking at a lot of different avenues to increase the number of people who have easy access to Narcan, who would be in a position to use it to save someone's life. And then that new grant is also going to help us create a multilingual communications campaign for the county around overdose prevention, and will ensure that we have accurate translations for our Snohomish Overdose Prevention website. So we are really excited about that one. So one other new exciting thing that we have that is now up and live and able to be accessed by anyone. So on our Snohomish Overdose Prevention website, which is the Snohomish County Overdose Prevention website, it's a partnership between the health district and Snohomish County. We started it when the multi-agency coordination group for opioids was very active pre-COVID. So this is a partnership, not just a health district project. But within our website, we now have a new and updated and much easier to use data dashboard. So this is where we will share data around opioid overdose. And the plan is to have it updated on a quarterly basis. So I believe it's actually being updated. Our FB was just updating it, or it will be updated in the next couple of days. So I actually haven't checked to see if what I'm sharing today is different than what I shared last week. So when I send out slides, I will put a link to the data dashboard in it if you want to click around to get really in the weeds. I didn't actually notice what time I started talking, Joe, but I think I don't want to talk too long. So
I'm not going to stop you.
Okay. Well, I'll screen share what the data dashboard looks like real quick, just since I didn't put any actually useful screenshots on my slides, but I will not drag you through all the data because I know I'm a data person. Some people are data people, but I will not make the assumption that everyone is a data person, which is okay. We need non-data people too. That's me.
I have a question. If
Yes.
you misdiagnose and give someone the Narcan, does that cause any problem?
Great question. No, it is a really safe medication to use. There is no adverse effects to giving Narcan to someone who you think might be overdosing from opioids, but who actually is not having an opioid related overdose. It just won't work. It's a really specific, the medication works really specifically in that it specifically targets the opioid receptors that are in your brain when someone's overdosing that are inundated with opioids. So if there are opioids present, it'll kick them off those receptors. If there are no opioids present, it's just not going to do anything. So
that's great.
Really low risk. Great question.
Yeah, thank you.
Jim, I see a hand from you as well.
Thank you. I guess my question is, if I were a user, I think I would be concerned that if I were attempting to obtain or purchase a kit, that somehow or another my name would end up on somebody's roster or list, like law enforcement or whatever. Is there some sort of attempt at allowing people who are purchasing some semblance of privacy?
That's a great question. So at least in terms of getting Narcan from a pharmacy, like I mentioned earlier, anyone should be able to get it. You don't need to be someone who is, currently prescribed an opioid or have to prove that someone in your household is currently, being prescribed an opioid. But I know that is a really valid concern for a lot of folks, and definitely is a barrier. Especially folks who use drugs often face a lot of stigma entering any kind of medical facility or establishment. So we know that is not necessarily a safe space. And I think that is part of the reason why we are just trying to increase the number of avenues that folks can access Narcan throughout the community. since going into a pharmacy and saying, I have Medicaid, I want to get an opioid or, Narcan kit, doesn't always feel safe or comfortable because, you're not 100% anonymous because it is going through insurance. So part of that is us just, communicating better and making sure folks know where else they can get it. Other community organizations do have it. A lot of it, the availability really just depends on funding at this point, which has not been 100% consistent for everyone. But like the Syringe Services Program in Everett, they have Narcan. They generally have it if they're doing outreach in the community. I know other outreach organizations generally try to have it on them as well. But yeah, there's no like perfect fail safe for making sure folks get to stay 100% anonymous if they are getting it from a pharmacy and using their insurance.
Thank you.
Yeah, the way that it works that folks are able to just walk into a pharmacy is that there's actually a statewide standing order. So basically the state health officer has like wrote a prescription for every individual in Washington state. So that's basically what is active. You don't need your own prescription to get it when you go to the pharmacy. So anyone who wants Narcan can get it under that statewide standing order. But yeah, if you're using insurance, you are still telling them that you want it. Yes.
So after we review the data dashboard, I'd like to hand this off to Chief Jolly, who can tell us what his officers are responding to in the community and how they're using the life-saving medication Narcan.
That would be great.
You'll set us up with the data and then we'll get on the ground intelligence from the chief.
Okay, that sounds perfect. I have a couple non-data slides after data. Do you want me to do those instead of data? Okay, you're muted.
Of course I am.
Okay.
That's what you got.
Okay, I want to make sure Chief Jolly has enough time too. Okay, I'm gonna do this quickly. Although Amber, I see a hand.
Was there somewhere that we could go on and get some Narcan mailed to us? Because I got some and I was like, I must have signed up for it somewhere. I didn't remember doing it. Did you already say that and I didn't hear you?
No, I didn't say that part yet. I think I have it buried in a later slide. I'm gonna just show this really quickly. Great. I actually have been meaning to do it myself and I keep forgetting because I wanted to test like how long it takes to actually show up to you after you request it. Was it quick or slow, Amber?
I'm gonna say maybe it wasn't quick because I had forgotten when I did it to the time I got it. I was like, I must have done it at some point.
But
so maybe it wasn't.
Okay. That's important to know. So yes, I will briefly mention that on a later slide. I am hopefully screen sharing right now a more zoomed in view of our data dashboard. So there are a couple main data sources on here. So basically there's death data, and then there is kind of more like zip code and county based death rate data just for comparison. And then there's some information from our emergency department data partnership around non-fatal overdose and use of naloxone. That's pretty much like what the tabs you can walk through at the bottom. So this is kind of like the big picture of who is dying from overdose and what those overdoses look like. You can see from 2017 to 2021, at least the last complete year we have, there's a real, as has been discussed frequently, there's been a real increase in overdose. And then if you look at the specific lines, the dark blue one is showing overdose primarily due to fentanyl. And you can see that is really driving the overdoses upwards, whereas heroin and other opioids have remained constant or actually like kind of slowly declined. But in 2021, about 80% of total opioid overdoses were due to fentanyl primarily. 2022 data is still preliminary, so this is only for the first 6 months of the year. And that actually, so this has not been updated yet. So this is the first 6 months of the year. I think we'll get Q3 data in here soon, but even those numbers sometimes take a few months after the end of the year to be fully updated. So we probably won't have like finalized 2022 numbers until partway into next year. But right now, we're still seeing about 80% of all opioid overdoses due to fentanyl. And then we do get some information about like characteristics of the folks who have overdosed, you know, primarily male, primarily non-Hispanic white folks. And then you can see the age distribution, you know, primarily folks in that 25 to 34 range, but still about 10% of people under the age of 24 who are dying from overdose. And, you know, certainly older folks as well. If you click on the year on here, you can kind of get the data to change and you can see it year by year. But if you unclick it, it's just showing you across that whole period of time. And with our new grant, we're hoping to be able to collect a little bit more specific data around race and ethnicity to kind of better do prevention work in those communities that are specifically impacted. So this is just kind of showing like what zip codes in our county are maybe more affected than others based on their population. Obviously, Everett being our biggest city and has a lot of, you know, folks in it is top of that list. We don't have it like, we just kind of have categories. We don't have the specific numbers. And then just to compare Snohomish County to the rest of the state, like, you know, obviously we see a lot about how many overdoses King County has, but based on their population, Snohomish County actually has a higher rate of overdose death per 100,000 people than King County does.
Juliet, Jim has
Yes.
his hand
Oh,
raised.
yes, Jim.
I'm sorry, I always have lots of questions.
Questions are great.
You mentioned old folks, us old folks. What percentage of older folks, say senior citizens or be considered senior citizens, are part of the user population? I'd be interested in that.
That's a great question. And I think that is one of the areas that it's really hard to get really accurate data on, like, you know, actual demographics of folks who are using. I will see if I can find that for you, Jim, and that might be a let me follow up with you offline question, but that is a great question.
It follows the thought that older males, or at least one point in time, were part of the suicide population, I guess, a pretty high population, and, you know, drugs or fentanyl, say, you know, would be unfortunately a way to do away with oneself, I guess, if one is looking to do that. I'm just trying to look for correlations there.
Yeah, no, that's a great question. And I know, you know, we do to a certain extent just see, you know, older adults having accidental overdoses due to just like accidentally taking their prescription twice when they're only supposed to take it once if it's a, you know, an opioid-based pain medication. But certainly there are folks, older adults, who are also using or misusing those prescriptions as well.
All right,
I think especially with fentanyl, I have a little bit blur about it later, but just because fentanyl is such a potent high risk opioid, like the risk of death is so much higher that's why we're seeing more young folks dying from overdose, like where in the past, you know, maybe it would be folks who'd used heroin for a longer time before they actually had an overdose that was fatal. With fentanyl, it just, there are fewer chances to get it wrong, basically. So, okay. I'm not gonna, yeah, no, that was a great question. We've got a couple tabs on just our overdose or our emergency department non-fatal overdose data. This kind of, you know, does show that same increase in fentanyl related overdoses, but not the huge spike we're seeing with death. And then you can kind of see a breakdown of how most folks are using these opioids. And then this other location of overdose one, I just think is really important to point out, because I think, you know, it's really common to assume that most overdoses happen in public places because we see so many people in public who seem like they're under the influence or, you know, impacted by drugs. But over half of overdoses are taking place in private residences. So, you know, it's important for people who are out in the community, if you're, you know, comfortable carrying Narcan, to carry Narcan, because you could potentially encounter someone who needs it. But that's why we're also focusing on making sure that folks who use and their family members, their loved ones, have it as well, because, you know, people are more likely to actually be in a home, whether it's their home or someone else's, when an overdose takes place. And then our last little tab is just showing that more and more folks are getting Narcan before they arrive at the emergency department, which is great because that means more people are using it. So I'm going to stop sharing this one now and turn it over to Chief Jolly.
Well, thank you, Juliet. I think she pretty much summed up the very same perception that I would have from an anecdotal point of view, and what we see here in Monroe. I can say that three things. We regularly deploy Narcan and perform saves on a regular basis here in Monroe, and weekly. The last overdose death that we had was earlier this week, and that person was in a public place across from Park Place Middle School. Fortunately, that happened in the evening, and so it didn't impact the school, the students, or other persons. So we are seeing the ramifications of increased drug use, which is the third thing. We are seeing a much more aggressive, open exchange and availability of narcotics here in the community, and I think Washington State as a whole. And when you take away the accountability piece and increase the level, the barrier for drug tolerance, obviously use availability is going to increase significantly, and that's what we're seeing in the last year, due to a number of things. Mostly legislative and court decisions. Hopefully, this next legislative session will be able to stem the tide a little bit. But while we as police don't believe that criminalizing drug usage or addiction is a way to get our way out of this opioid epidemic, it is a key tool that we're not being able to bring to bear right now. We would love to be able to impact this and aggressively go after people that are using it, get them into a diversion program. We don't want to incarcerate or put people in the prison system for this, but it is a tool that has kind of a valuable aspect of getting people some help. So that's kind of where we're at. And I am hopeful that we are able to get some of those tools back to law enforcement so we can partner with our health district and our health community to stem the flow of some of the ramifications of this drug usage. So that's where we're at now. We're standing by to see what happens over the next year or so. And if anyone has any questions, I'd be happy to try to answer them.
Our friend Jim Bloss has a question.
Sorry, Chief.
Jim, I knew it was coming.
Well, I guess what I'm thinking is, does your ride along program, the social worker and so on, when you're doing outreach in the homeless community or someone you see on the streets, are they picking that up? And is that a possible save situation, given that you don't have to report it?
When they're dealing or running across those individuals?
I think it would be, well, I think if you're seeing somebody dealing, that's another story. But I mean, you're going to run across people who probably present as users and really need the help.
Gotcha. They again regularly enter people into housing programs, the diversion center in Everett, drug treatment programs. I saw one transpire when I was hanging out with them just last week. So it's always the preference of us to say, hey, well, at least previously, we've got these drugs, we can go to jail, or I can get you into a diversion center right now. I mean, we'll take care of that, and we'll make those deals right at street level. And that was kind of the bread and butter of our business. But right now, it's we're having to get a little creative, just because it's trending towards being decriminalized entirely.
So it's okay, Chief. We know you're the good guys.
Well, try. But yeah, so the embedded social worker that deals with our homeless outreach, population that they aggressively seek solutions that don't involve criminal stuff. That's what the whole program is about. And it's not just drugs, it's mental health is a huge component and body of their work, right?
Right.
You get those people some help.
Thank you.
You bet. Oh, good. I got off easy. Joe, back to you in the newsroom.
Well, okay then. Chief, I really appreciate your perspective. Juliet, I'm going to hand this back to you. You're going to touch a little on an emerging substance that's not here in Snohomish County yet, right? Okay, it's all yours.
Okay, yes, I will briefly cover that, and then I have just a couple more, like, hopefully useful resources that to share. One of which is new. Okay, let's see if I can get my sharing right this time. Oh, that didn't seem to work. No, not what I wanted to do. Okay, we're gonna screen share first. Share. Not back to the beginning. Okay. Yes, so the new substance that we are just kind of starting to sound some alarms about, although as Joe mentioned, we have not had confirmed reports of this in Snohomish County yet. It's primarily been seen on the East Coast, although it is making its way west. A few other counties have seen this. Is a drug called xylazine. It is actually an animal tranquilizer, so it's a veterinary medication. But it's pretty much just a very strong tranquilizer. It is not approved for human use, and it increases the risks of drug poisoning or overdose, especially when it is combined with an opioid. So we know that for folks, anytime someone's using an opioid medication along with any kind of sedative like alcohol, benzodiazepines, because those all already like suppress breathing, it makes it that much riskier for someone to use opioids, and makes overdose more likely. So what's been seen in other places is that xylazine is basically being added to illegally made opioids, primarily powders and pressed pills, which generally also contain fentanyl. So together with fentanyl, it's a pretty dangerous combination just because of that increased risk for overdose. It doesn't seem to be really like the main driver behind increases in overdose at this point. That still is really just due to fentanyl. One of the bigger risks actually for folks who end up using xylazine, in addition to kind of an increased risk of overdose, is actually a lot more like tissue damage, infections, things like that. But when someone unintentionally uses xylazine with an opioid, it is a lot more likely to slow brain activity, slow breathing, slow heart rate, etc. So our main messaging that we are kind of putting out and are prepared to put out around this especially, is that if someone seems like they're overdosing, you should still give them Narcan. The Narcan or the naloxone will not specifically work on the xylazine, but it will still reverse the impacts of the opioid. Sorry, I have a cuddly cat right now. Will reverse the impacts of the opioid overdose. So it'll still do what it would normally do if someone was overdosing from opioids. And then in addition to that, if someone seems like they were really knocked out, or if we do find out that this actually does make its way to Snohomish County, that people actually give rescue breaths with the Narcan as well, because we really want to make sure that if someone is having an overdose and also impacted by xylazine, that they start breathing again. And generally they will, the goal is to get them to breathe. They will not be like revived like they would if they were just overdosing from opioids and had been given Narcan. Generally that actually causes someone to like wake back up. But if someone had also taken xylazine, they might actually still be pretty sedated, but as long as they're breathing again and they stay breathing until EMS arrives, that's the goal. So it is very scary sounding, but it has not made its way to Snohomish County yet, as far as we know. And aside from this additional messaging, we really are just sharing the same like overdose prevention and Narcan messaging that we have been sharing around having Narcan on hand, knowing how to use it, you know, for folks who are using, that they go slow, don't use alone, because if you overdose, you need someone who's with you, who's able to revive you in case you do overdose. And then making sure that folks always know to call 911 in case of an overdose or drug poisoning. You know, we know there are a lot of folks for whom calling 911 doesn't always feel safe, but that just really increases chances that someone will survive an overdose event. So that is the new and scary thing that we hopefully won't even end up seeing in Snohomish County at all. And then just kind of circling back to the fact that fentanyl is really what is still driving the overdose crisis. It's 50 times stronger than heroin. It is a really powerful opioid. Overdose can happen really quickly. And just like in Snohomish County, statewide, this is still the main driver of overdose. So I mentioned, I think in 2021, about 80% of overdoses are due to fentanyl. That is still the trend so far for 2022. And then, especially with messaging for young people, youth, when we're talking about fentanyl, most of the time youth don't know that they are using fentanyl. They may not even know that they're using an opioid, or they may not be trying to use an opioid. They could have gotten a pill from a friend at a party, thinking it is, you know, any other kind of thing, like not even trying to use what they think might be a prescription opioid that someone stole from their parents' medicine cabinet or something. They most often look like these little blue pills at the bottom. We generally, they just call them M30s because they have the M and the 30 on the other side. So those are generally what a laced pill would look like. And there's no way to know whether or not it has fentanyl in it unless you're actually like testing it, which, you know, most youth, if they think that like maybe it's a Percocet, or maybe it's, you know, who knows, just some pill that their friend's friend got out of their older sibling's medicine cabinet, I don't know, that it really could, you know, would never contain fentanyl, so why would they test it? The amount of fentanyl can really vary, and like from pill to pill, it can also vary within a pill. So if 2 kids are splitting a pill, 4 youth are splitting a pill, whatever, the amount of fentanyl in each of those portions can vary. One of those kids could have a really severe overdose, the other 3 would be totally fine, and we have seen that happen for both youth and adults, which just makes it, you know, extra scary. In Snohomish County, we have other partners in other areas who have actually started using the terminology more around like drug poisoning and opioid poisoning, because overdose tends to kind of carry the connotation of, first of all, that you're intentionally using an opioid like heroin or something, but also the overdose seems to imply that you're taking too much, whereas this can happen with a really small amount of fentanyl. So it really is more of like a very quick drug poisoning rather than, oh, I took 4 pills instead of the 1 pill I was supposed to take. The signs of fentanyl overdose are pretty much the same as the signs of an opioid overdose. It just may happen more quickly, but someone's not breathing, gurgling when they're breathing, heavy snoring. If they won't wake up, especially if you try to wake them up, what's recommended is to do like a sternum rub. When we do our Narcan training tells you exactly where to do it, but if you like rub your sternum really hard with your knuckles, it's very uncomfortable. If you are not unconscious, you would wake up if someone did that to you. That's a great way to tell if someone is actually unconscious or overdosing or not. Blue or gray skin, lips or fingernails, chest muscles may get stiff. It's, you know, for youth especially, it's really easy to think that like maybe someone at the party has just like fallen asleep or passed out, when in fact they could be overdosing. So we are working on making sure that Narcan is accessible to everyone, including youth who want to get it. So I think, I forget, someone put the link that Amber had mentioned in the chat before she logged off. That should be the link that should still be active to get a free Narcan kit for anyone in Snohomish County. So it's mail, it should come to you in the mail. It may take a few weeks. But if that, you know, it's the easiest way for someone to request it, they can do it that way. There's no age minimum on that, and there's no age minimum in the state standing order. So anyone, any age can get Narcan.
Hey, Juliet,
yes.
I have a quick question. So I'm loving the language around opioid poisoning in terms of youth prevention. You know, it's always on our mind how we balance fear arousal with enhancing risk of harm, because one prevents use, one encourages use. And so opioid poisoning is language I could really use. So my question is this a Snohomish County Health Department language or term, or is this a more broadly used term?
I think this is the goal. The hope is that this will be a more broadly used term. I think we actually, myself and at least one of my other teammates, I forget, we were on a webinar with, I want to say maybe it was King County,
Okay.
Or another jurisdiction, and they were sharing that like that was language they were starting to adopt as well. So I think it will be language we'll see more frequently in communications, not just stuff coming from the health district.
Okay, the reason why I ask is because Department of Health and the Healthcare Authority are working on joint messaging. And so I'll forward that on too. I love that language. So thanks.
Great. Yeah, and I'll see if I can find anything else like more official with where that is coming from or where we first saw that, because I know we did first. There was a source that it came from. Okay, I think this is pretty much my second to last slide. Before I go to that, Jim, I see a hand. I see a question.
I promise this is my last one. My son-in-law works for the CDC, and he works in the opioid epidemic sort of type thing. And he says when they're gathering their data, it's pretty difficult to get accurate data because a lot of the information about deaths and so on come from coroners and autopsies. From jurisdictions all around the United States. He's looking at those figures, and because they all keep track of these things differently, So I'm wondering how you get the they work to that, and they figure out ways how to make those figures accurate. So I'm just wondering what your sources are for your information and how you get that information. I don't need all the details, but I assume you gather it from a number of different places, and probably from top down and bottom up and what have you.
Yeah, no, that's a great question. So on the data dashboard, there are two main sources. So the death data that we shared there mostly comes from the Snohomish County Medical Examiner's Office. Some of that, there's also death data that is collected by the Washington State Department of Health, and I think some of it may be supplemented, but it should on there specify which source. And then the hospital partnership I mentioned, where we get the non-fatal overdose data from, is actually funded through a CDC grant that goes to the Washington State Department of Health, and then we are a subrecipient from them. But that is a big program. A lot of folks country across the US have this grant as well. Other folks in the state or in Washington State do as well. But it's an overdose data to action grant. So it's actually like a specific effort from the CDC to try to get better collection methods around collecting overdose data, because yes, that has been an issue, and it's definitely been a challenge in quantifying things at the state level, but especially at the full country level, since it can really vary jurisdiction by jurisdiction.
Thank you.
Okay, and then I will do these two slides really quickly because I think we're just about done. But I just want to share one resource which is new. It is a King County resource because King County gets all the money and all the nice things first. But this is a parent-focused campaign around talking to your kids about fentanyl. Because we know that honest, accurate information is really important. We know that youth trust their parents, even though they're in middle and high school and they seem too cool for school. Information from their parents does still really matter. So this new campaign is called Talk Even If. It's pretty much even if you don't think your teen or your youth is specifically at risk for using a substance that might have fentanyl in it, there's still a lot of good reasons to talk to them about do they have friends who might use, like, you don't even, it has examples of, like, you don't need to tell me who that person is, but do you think it's worth knowing how to use Narcan, or like finding Narcan, those kinds of things. Knowing the signs of overdose, just making sure that youth have these tools and know what's going on, because we have seen a lot of youth overdoses due to fentanyl in the past year, or more than a year, but especially the past year. So it has some just kind of the facts, it has what the signs might be, and then it has some conversation ideas, and it does have a Find Naloxone page as well, which has a link. So because this is a King County site, it does have a link. So King County has its own naloxone or Narcan program, but then it has a link to for anyone outside of King County, which is that same link that we mentioned, that Amber mentioned, that you can request mail order naloxone or a mail order Narcan kit from as well. So I wanted to share this all when I share slides or when I have to send stuff to Joe to send out. I'll have the link for this website as well, just because I think it's new. I'm like not super familiar with it yet because it just launched, but I think there's a lot of great content in here. And then, oh, this is my just brief little. This is just a screenshot from that campaign. But as I mentioned, knowing how to use Narcan is really important, and it is really simple. You literally just open the package, put it in someone's nostril, spray it, and then breathe. You know, give them breaths. If you're comfortable with that, call 911. And then keep an eye on them until 911 arrives. If they still don't if they're still not revived, you can give additional doses of Narcan. Often with fentanyl, it does take more than one dose for someone to be revived because it is such a strong opioid, or someone can be revived and then a few minutes later they can start to overdose again, or before EMS arrives, they can kind of go back into the overdose because the naloxone has worn off, but still enough opioids in the system that the person is still overdosing. So staying with them until 911 or EMS arrives is really important. And then this, I promise, is my final slide. This is just a link to our Snohomish overdose prevention website. We have some local treatment resources and resource guides on there as well. But there's also a statewide, the stopoverdose.org is the statewide resource. And they do, you know, they're statewide, they have more money, so they have fancier things. So they have even more content than we have. And they have a like bigger fine treatment portal. So there's a lot of great content on both of those websites. And then Laced and Lethal is King County's youth-focused fentanyl education campaign. So Talk Even If is aimed more at like parents and influential adults. Laced and Lethal is for youth themselves, but it has, you know, if you had a youth who really wanted to access that info themselves and learn about it, it has a lot of great, really youth-tailored messaging around fentanyl, why it's risky, you know, how it's likely that you could encounter something that's laced and why it's so lethal along those lines. Okay, that's it. That's the end. Thank you all so much for letting me talk for so much of this meeting.
Thank you. That was excellent.
We're so grateful for you, Juliet. I knew this wasn't a 20-minute conversation. And so really, truly thank you. I want to show one thing before we are done here. And Juliet, we're just so privileged to have you be a regular member of the coalition. So
the privilege is mine, Joe. I have loved being a part of this group. So
thank you.
Thank you.
We'll be knocking on your door. And I love the idea of pairing the mail order naloxone information with a local naloxone training. So I'll be reaching out and trying to connect with you on that. From a coalition perspective, the one thing I need to share with you before we move on here is brief business updates. If you get the newsletter, then at the bottom of each newsletter is exactly where we are in implementing coalition trainings and programs, both within the school district and in the community. Our big push in October was disseminating the annual community survey of adults, which we've done every year since 2013. We have nearly 400 respondents, so we exceeded the coalition contract requirements of 230 people from Monroe can give us fairly good understanding about where most folks are. So we've nearly doubled that, and that really helps us. What I'll be doing is putting together some information for you, and we'll do some small group work around interesting information that you might want to put out into the community, and really dependent on your ideas for how we communicate and what parents will need to know from this. And then the other piece of information is, in November, I did not disseminate the coalition assessment tool. If you've been a part of the coalition for some time, you know this is the most annoying contract obligation that we have. However, it really does help adjust and fine-tune some of the coalition activities. So you're going to get an email at some point from me within the next 7 days that asks you to complete this. I won't see the results based on individual scores, so you can be as honest as you want to be and know that the leadership team will look at the results when we get them back from the state and come to you about making adjustments where we see those are needed. If you've attended 3 meetings or more, you can expect to get it. And if there are areas that it's asking information for that you don't know the answer to, just reflect that in the survey. So it's a contract requirement. Otherwise, I wouldn't be coming to you, but we have used it to improve the quality of our meetings and offerings. So the CAT is coming, the coalition assessment tool. And so if you've been with me for a while, just expect that. Otherwise, I am happy to give you guys 10 minutes back, or if there are some updates you'd like to share with other members of the coalition, now is your time. I'm just going to take a step back and listen. Anybody have information they'd like to share? Oh, Rachel, thank you. East County warming shelters are open tonight at 8 p.m. Tom, any words of wisdom as we head into November and December?
You know, Joe, I was really thinking about Rotary's focus on inclusion. And I was so glad when the elections were over, because day after day, minute after minute, we were hearing how bad the opponent was. The absolute opposite. And it reminded me of a talk I heard one time where they were comparing competitive to contributive. And in a competitive society, I'm trying to one-up you. In a contributive society, we're all trying to add something. And I just love that idea that inclusion is the focus on adding. It's not competing, it's contributing. And we watched, you know, there were a lot of really rotten people running for office, if you could believe those all of those ads. And I'm just thinking that just sets such a tone. And then just after it was over, or just the other day, my son was doing some ladder stuff on the roof for me. And his 3.5-year-old son is there, and he likes to help his dad. And my son is up on the ladder, and my grandson says, "Dada, you're doing a great job." A 3.5-year-old. And I'm thinking, that kid has heard that before. "Dada, you're doing a great job." And I just think, boy, that's so missing today. It's so missing. But in contributing, if we can focus on the people that we, you know, not focus on where we disagree, but focus on what we can all contribute. And it's going to change the paradigm. So, but it's nice to see that Rotary's taken on a big challenge like that. So thank you, everyone. And I thought mine was a great question until everyone's question was great. And I said, that's a great way to deal with a question, because you could also, Julie, nice job. You could also say, well, that's a stupid question. So anyway, thank you, everyone. And always thanks to Joe for just the wonderful work he's doing in our community. Anyone else can sign off? Adios.
Thank you.